Did you know that even a small sore in your mouth can be the very first warning sign of a dangerous disease? Oral cancer, especially in older adults. Never underestimate even the slightest change in your mouth, because as we age, our bodies send out subtle but extremely important health signals. Oral cancer, when detected early, can save your life and help maintain your quality of life. However, most of us tend to overlook the early signs, either out of carelessness or lack of awareness. In today's video, I will reveal to you a series of symptoms that might seem completely harmless at first, but are actually warning bells from within your body. From mouth sores, changes in color, to unexplained numbness or persistent pain. Before we get started, take a moment to leave a positive affirmation in the comments section below, a small commitment to attract good things into your life. For example, I honor and listen to my body every day, or feel free to share your own personal affirmation. And do not forget to like this video and subscribe to the channel so you never miss out on valuable content about senior health. Let's build a community full of positive energy and mindfulness around our health. To understand more clearly, let's begin with a brief overview of the disease. Oral cancer is a type of cancer that occurs in the tissues of the mouth or throat. It starts when normal cells in the oral cavity, including the lips, tongue gums, inner cheeks, the roof of the mouth and the floor of the mouth, begin to grow abnormally and uncontrollably. These cells eventually form a tumor, slowly spreading to nearby areas, and if left untreated, they can metastasize to other organs in the body. In the early stages, these changes are usually very subtle. It may be just a small sore that does not heal, a red or white spot appearing on the tongue or inside the mouth, or a vague discomfort when chewing or swallowing. Because the early symptoms are mild and easy to ignore, oral cancer often goes undetected until it reaches a more advanced stage. One characteristic of oral cancer is that it can develop in any part of the oral cavity. The most common areas are the sides of the tongue, the floor of the mouth under the tongue, and the area at the back of the throat. Over time, the tumor can cause serious damage, like deep ulcers, prolonged pain, difficulty eating and speaking, and even affect the patient's appearance and mental well-being. Oral cancer can be life-threatening if not detected and treated in time. But the good news is, this disease is entirely manageable if identified from its earliest signs. And now, as promised, I will reveal to you the very first warning signs of oral cancer. First sign, a sore in the mouth that does not heal after 2 weeks. Usually minor injuries like accidentally biting your tongue, canker sores or irritation from eating or drinking heal on their own within a few days to a week. The lining inside the mouth is rich in blood vessels, so it naturally regenerates quite quickly. However, if you notice a sore on your lips, tongue gums, or any part of your mouth that does not show signs of healing after 2 weeks, or even gets worse swelling or becomes painful, then that is a serious red flag. This could be an early sign of abnormal cell changes in the mouth, something that needs to be examined by a specialist immediately. It is important not to be dismissive and assume it is just a regular canker sore, because if it is a minor wound or irritation, it usually heals quickly with mild burning or stinging that eases significantly after a few days. In contrast, a sore caused by malignant changes typically does not hurt much at first, but it lingers, stays dull, and does not heal on its own. Second sign, white, red, or mixed white and red patches on the oral lining. Normally, the inner lining of your mouth is pale pink, smooth, and even. Any change in color, especially the development of distinct patches, is a sign that the surface cells might be in trouble. In medical terms, a white patch on the mucous membrane is called leukoplakia. This occurs when the cells of the mouth lining are irritated and thicken, forming persistent white areas that cannot be wiped away. Leukoplakia can be a precancerous condition, and without proper monitoring, some cases may progress to actual cancer. On the other hand, if the mucosa shows bright red, easily bleeding patches, doctors refer to this as erythroplakia. This condition is even more concerning than leukoplakia, because erythroplakia is more likely to contain malignant or pre-malignant cells. Unlike white patches, which often do not hurt, red patches may come with a burning sensation, mild pain or discomfort when eating. What is especially dangerous is when both white and red patches appear together, blending into each other. This type of mixed lesion indicates a more complex abnormality in the tissue and a higher risk of malignancy. Third sign, unusual lumps or swelling inside the mouth. In general, small bumps from biting canker sores or minor trauma from eating will disappear within a few days. However, if you notice a lump or unusual swelling that is not painful, persists for several weeks, and shows no signs of shrinking, this could be a serious warning sign. A key point to note is that tumors related to early-stage oral cancer often do not cause pain right away. This silent progression means many older adults and even non-specialist doctors may confuse it with benign conditions like minor infections, fatty tumors, or blocked salivary glands. Swollen or lumpy areas can appear anywhere in the mouth, from the inner cheeks, gums, tongue, and floor of the mouth to the roof of the throat. At first, they might be as small as a pea or grain of rice and cause no obvious discomfort. But over time, if left untreated, they can grow, distort the structure of the mouth, and interfere with chewing, swallowing, or speaking. What makes it dangerous is that because it does not hurt, people tend to overlook it, leading to delayed diagnosis. So if you happen to notice any lump or swelling in your mouth that has not gone away after 2 weeks, it is best to consult an ear, nose, and throat specialist or a dentist for a thorough checkup. Fourth sign, unexplained bleeding with no clear cause. Bleeding in the mouth usually has a clear reason, such as biting yourself, canker sores, or brushing your teeth too hard. In these cases, the bleeding stops quickly and the wound heals within a short time. However, if you start noticing blood in your saliva or bleeding that occurs easily with light pressure, like while brushing or eating, and there is no clear reason, it could be an early warning sign of oral cancer. In the early stages, cancer can damage tiny blood vessels just beneath the surface of the mucosa. This damage does not cause noticeable pain, but allows blood to leak out easily, even with the gentlest contact. What is especially concerning is when bleeding is accompanied by other signs, like a non-healing sore, abnormal white or red patches, or unusual lumps in the mouth. This is no longer just a dental issue. It could be a sign of malignant cellular changes happening beneath the surface. Fifth sign, numbness or loss of sensation in the tongue, lips, or cheeks. Under normal conditions, the mouth and its related structures are highly sensitive. Even a small scratch or a slight change in temperature is clearly felt. But if you begin to feel numbness or a lack of sensation in any part of your mouth for no apparent reason, this could be a signal that the nerves in that area are being damaged. In cases of oral cancer, cancer cells not only destroy the tissue where they originate, but can also invade nearby nerves. When that happens, patients may begin to notice unusual sensations like tingling numbness to touch, or a strange feeling like there is something in the mouth even when nothing is there. These symptoms are often subtle and not obviously painful, so they can easily be mistaken for common dental issues or simply blamed on fatigue. What makes this especially dangerous is that the numbness can occur without any visible surface injury. That means you might not see any sores or discoloration, but the nerves are already being affected underneath. If this numbness lasts a long time, starts to spread, or is accompanied by other symptoms such as difficulty moving the tongue, stiffness in the lips, or trouble speaking, there is a high chance that the cancer has already invaded the nerve tissues. In older adults, it is important to distinguish whether the numbness is due to vitamin deficiency, diabetic complications, or oral cancer. Any numbness or loss of sensation that persists for more than 2 weeks and does not improve with rest or oral care should be checked immediately by a medical specialist. Sixth sign, difficulty, swallowing, burning pain when chewing or speaking. Normally, swallowing food, drinking water, or speaking happens naturally and effortlessly. However, when you begin to have difficulty swallowing, feel something stuck in your throat, or experience burning pain while chewing or talking, these are signs that there may be an abnormality in the mouth or throat area. Among older adults, difficulty swallowing is sometimes mistakenly attributed to common causes like mild throat infections, dry mouth from aging, or weakened swallowing muscles. But if the problem lasts for several weeks and does not improve with hydration, rest, or proper oral hygiene, then it is no longer a normal aging issue. In oral cancer, growing tumors can obstruct the natural pathway of food and air, causing a sensation of blockage pain when swallowing or discomfort during speech. Especially concerning is when the pain starts off mild and gradually increases over time, or if it occurs on only one side of the throat or tongue. These are symptoms that deserve extra attention. The key difference between difficulty swallowing due to a sore throat or dry mouth and difficulty swallowing due to cancer is this: throat infections or dry mouth usually come with acute signs like mild fever, a strong burning sensation in the throat, and tend to resolve quickly with a few days of treatment. In contrast, swallowing problems caused by cancer develop slowly, do not respond to anti-inflammatory medications or basic care, and get progressively worse over time. 7th sign: unusual changes in your voice. In healthy individuals, the voice may temporarily change due to a cold, sore throat or seasonal allergies. These cases usually come with symptoms like nasal congestion, sore throat or dry cough, and typically resolve after a few days of rest or medication. However, if you notice that your voice becomes hoarse, you struggle to speak clearly, or your voice loses its clarity, and this happens without the typical signs of a cold or allergies, and persists for more than 2 weeks without improving, it could be a warning sign of something more serious. In oral cancer or cancers of the pharynx, voice changes can occur when tumors press on nearby nerves, muscles, or the larynx. This affects the vibration and control of the vocal cords, making the voice sound hoarse, muffled, or weak. This becomes especially concerning if the voice change comes along with other symptoms, like difficulty swallowing, burning pain when speaking, or a sensation of something stuck in the throat. These signs strongly point to the possibility of oral cancer, a key way to tell the difference. Hoarseness caused by a cold or allergies usually improves quickly once the inflammation goes down, but hoarseness from malignant damage lingers quietly and often gets worse over time. 8th sign: jaw pain or stiffness when opening your mouth. Normally, opening your mouth and moving your jaw should feel natural and flexible without any discomfort. But if you start experiencing difficulty opening your mouth, jaw stiffness or pain during movement, especially when eating or speaking, this could be a serious warning sign. In some cases, this may be caused by relatively minor issues like temporomandibular joint inflammation, grinding your teeth, or a light injury. However, if the jaw pain or stiffness happens quietly, persists over time, and does not improve with basic treatment, it should not be taken lightly. With oral cancer, as the tumor grows larger, it can spread to nearby structures, including the temporomandibular joint, the joint connecting the lower jaw to the skull. When this joint is invaded or compressed by the tumor, the patient may feel stiffness, pain, and limited movement of the jaw, as if an invisible force is preventing normal mouth opening. This becomes even more alarming if jaw stiffness is accompanied by other signs like non-healing mouth sores, lumps inside the mouth, trouble swallowing, or voice changes, all of which further increase the likelihood of oral cancer. Detecting and addressing jaw pain early is extremely important. You should not attempt to treat it at home or delay seeing a doctor. Only through detailed imaging tests and a thorough examination can a doctor accurately determine the cause and recommend the right treatment. 9th sign: persistent bad breath that does not improve with good oral hygiene. Usually, bad breath can be caused by simple things like eating strong-smelling foods, poor dental hygiene, or gum disease. With proper oral care, brushing your teeth regularly, rinsing your mouth, cleaning between your teeth, and drinking enough water, ordinary bad breath tends to go away quickly. However, if you notice that your breath has a foul odor that lasts for several days or even weeks and does not improve, despite good oral hygiene, it could be a sign of a more serious problem inside your mouth. In cases of oral cancer, when cancer cells grow aggressively, they not only destroy healthy tissues, but also lead to tissue necrosis, meaning parts of the tissue die and begin to decompose inside the mouth. This process releases sulfur compounds and other harmful gases, causing a strong distinctive odor that regular oral care cannot eliminate. The danger is that this kind of bad breath can easily be mistaken for minor dental problems or digestive issues, causing people to ignore it or delay seeing a doctor. This often leads to late-stage cancer diagnosis when the disease has already progressed significantly. Now that we have identified the warning signs, let's take a look at the risk factors that increase with age. Besides recognizing the early symptoms, understanding the risk factors that become more prominent in older adults plays a critical role in preventing and detecting oral cancer early. Starting around the age of 55, the body goes through many natural physiological changes, making it more vulnerable to risks that can trigger serious conditions. One of the biggest risk factors is a history of smoking or using smokeless tobacco products. The harmful chemicals in cigarette smoke and chewing tobacco can damage the mouth's lining over time, paving the way for abnormal cells to form and grow. Long-term alcohol consumption is another significant contributing factor. Alcohol not only directly irritates the mucous membranes in the mouth, but also weakens the immune system, reducing the body's ability to repair damaged tissues and increasing the risk of malignant transformation. A diet lacking in vegetables and fruits is another silent but significant risk factor. Fresh produce is loaded with antioxidants, natural compounds that help protect the body from the harmful effects of free radicals. These free radicals are unstable molecules that can damage cells and over time contribute to the development of cancer. Without the protective effects of antioxidants, your body's defenses are weakened, making it much more susceptible to abnormal cell growth. What seems like a simple nutritional gap can, in the long run, have serious health consequences, especially for older adults whose natural repair systems are already slowing down. Additionally, older adults who have a history of human papillomavirus, especially the high-risk strains, are at a significantly higher risk of developing oral cancer. This virus has the ability to interfere with the deoxyribonucleic acid of mucosal cells, setting off a chain reaction of changes that may eventually lead to malignancy. The scary part is that these changes often occur silently without any noticeable symptoms at first, which is why regular screenings are so crucial. Poor oral hygiene is another major factor that should never be overlooked. The buildup of plaque, untreated chronic infections in the mouth, or using dentures that do not fit properly, which may cause constant irritation to the soft tissues, can all lead to repeated cellular damage over time. This chronic irritation creates a breeding ground for cancerous changes, especially when combined with other risk factors. Lastly, a family history of cancer raises the likelihood of developing the disease in future generations. This can be due to inherited genetic mutations or because of shared environmental influences and lifestyle habits within the family. Being aware of this risk should encourage individuals to be even more proactive in taking care of their health. Understanding these risk factors empowers older adults and their families to take meaningful steps toward prevention. By adopting healthier lifestyle choices, eating a balanced diet rich in nutrients, maintaining good oral hygiene, and scheduling regular medical checkups, it is entirely possible to detect problems early and manage them before they become serious. Take charge of your oral health, maintain a healthy lifestyle, and get regular medical checkups. Health is a priceless gift we must protect every day, especially as we grow older. Before we wrap up, if you found today's message helpful, leave a positive comment down below like "I listen to my body every day." And do not forget to like this video and subscribe to the channel so you never miss any valuable health tips for aging well. Let's build a loving, healthy, and positive community together. Wishing you peace and vibrant health every single day.